Hi, this is Dr. Adra at Kinetics 365. We're going to discuss pain because a lot of people that come to the clinic understand simply that there's either acute pain or chronic pain. No matter what it is, you treat it with the same thing. So I'm here to tell you otherwise. In fact, there's several types of pain. We're going to go through some of them. Maybe this will help you understand what you're going through a little bit better. First, we have what we call chemical pain or inflammatory pain. Think about it, I call it chemical because your body reacts chemically by releasing certain inflammation inside the area where you have the pain. You normally see that with inflammation, for example, caused by a trauma, like you got a car accident, you slipped, you see swelling, you see redness. The pain is typically constant, it hurts pretty much all the time. For that kind of pain, another chemical could be quite helpful. This is where things like Advil, anti-inflammatories, turmeric, things of that sort help. Icing in this case also helps because you're trying to decrease the amount of chemicals in the area. The second type of pain is what we call mechanical pain. That's the pain that you feel every once in a while, maybe when you move in one range or the other. These are typically caused by habits. For example, like you're looking down on your computer or your phone, you're holding your neck in one position. That causes strain over time on the tissues, and then you get mechanical pain. Mechanical pain does not respond as well to the things that chemical pain responds to. This is typically where things like heat improve a little bit better, local creams, things like Bengay and Biofreeze and things of that sort. The third type of pain is what we call nerve pain. Now, the nerve pain is kind of split into two. So there's third type, nerve 1, where the nerve is stuck. The nerves don't travel in your body in space. They travel through this thing called fascia. Fascia means wrap. That's the white thin sheath of ligaments or tissue, right, that envelops muscles. So let's say I have nerve that goes down from my neck down to my arm. It's traveling through that fascia in between muscles. If you have some scar tissue there because of, again, bad habits like repetitive typing or old injuries, the neck will not glide very well. That's called a nerve entrapment. That gives you a very unique type of pain. Usually like you're about to do something, I'm going to reach, kind of sharp burning sensation. Typically nerve pain is unique because it gives you burning. It feels like sometimes water going down your arm or your leg, heat, cold sensations, tingling, numbness, things of that sort. These are all nerve type pains. Again, they may not respond as well to the chemical type of pain and the mechanical type. Fourth is nerve root. So there's your roots. Nerves are like trees. The roots are in the spine. As they come out, they form a trunk somewhere in your body, here or here, and then they kind of go into different major branches and then leaves, okay? The roots are very unique because they're slightly, again, treated differently than the trunk. If the trunk is trapped, like the third type of pain. The roots typically are typically caused by compression somewhere along the spine, like a disc bulge or like a bony growth where the nerve root lives. These are pretty severe sensations. Typically, the pain is more constant or consistent than a jab when you move your arm or your leg. There's almost always tingling or numbness associated with it. Those are kind of tricky to treat, but can be treated. Again, not like the first three. They have their unique set of exercises, different than third, second, and first, okay? Fifth type of pain is what we call this is like the autoimmune, very organic, we call it, type of pain. So unfortunately, if you have either genetic tendency to have autoimmune diseases like rheumatoid arthritis or lupus, these are very difficult to treat. Of course, you should seek medical care because typically the treatment is, again, different, and it's caused by a genetic dysfunction that causes your immune system to attack an area, hence causing the pain. The sixth category is actually the trickiest one, is basically what we have is pain that is there all the time. It's worse when you're tired. This is the type of pain that we call sensitization. Why we call it sensitization is because you've had it for so long that your brain is now accustomed to it. These are things like fibromyalgia, pain with chronic fatigue syndrome, things of that sort where they don't really respond very well to typical things because the pain is perceived at a higher level. So let's say if I press my finger here, If I don't have sensitization, my brain doesn't perceives this as touch or pressure. But for people with that sensitization where their brain receives or picks up the information at a higher level, that is what we're talking about here. At that point, you have to treat the brain itself. These are people that typically need either medications that target the brain or supplements that target the brain and the hormonal system. So there's other smaller subtypes. We just gave you the big 6 is what we call them. If you understand which one of these, you can match the proper treatment to the proper pain type that you have, improving your chances of getting better quicker.